So, in fact, I would call it ultrasound scan guided or image coded um, surgery. It involves using technology of imaging, which is in my area, is the ultrasound scan, where I developed special skills over the years of ultrasound scan and using the skills during the endometriosis surgery in particular, and during any other gynae surgery, is quite useful in identifying the disease and excising the disease as an outcome. So, in particular, this is only a skill or a technology we use to make the surgeon more able to see the endometriosis or any other disease which needs or require taken out during surgery. So that increases the precision and accuracy of our operation, and we make sure we don't miss any disease behind. So it's an extra deep vision that the surgeon can assess the disease better. For example, if there is endometriosis in the retroperitoneal spaces around the root of the nerves, or in spaces that you cannot see normally during keyhole surgery or laparoscopy, a ultrasound scan, whether transrectal or transvaginal, can allow the surgeon to visualize the disease and take it out accurately, rather than opening unnecessary spaces or increasing the morbidity of the surgery. So the benefit for the patient is enormous. We make sure that we only target the disease we want, and we make sure we don't miss disease behind, and we make sure that we take the disease which is causing the problem. I have to say, in many times, the endometriosis surgery is fine without using intraoperative imaging or image-coded surgery. And this is simply because the disease is well visualized during the surgery. However, it becomes very tricky when the surgeon cannot visualize the disease. And this is the situation where you need some imaging to help you to see the disease during the operation. You can always review the pre or before surgery imaging to map your surgery, but sometimes even with this is not enough. And this is when using the ultrasound scan during the surgery becomes very helpful tool for the patient and for the surgeon. It is not extra procedure. It's very safe. It's just using ultrasound scan or imaging during the surgery. So it's completely safe. There's no extra risk to the patient. It's just a tool like any other surgical tool that the surgeon is able to use during the surgery. So it's another ultrasound scan monitor screen. So you will have, instead of one screen, which is the keyhole surgery or the laparoscopic surgery, you have another screen where the surgeon can map or look at the ultrasound scan image. And for the patient, there is no extra cost at all, and there is no extra stay in the hospital. I think there is no ideal candidate. All patients should benefit from this extra facility to visualize a disease during the operation. And this is whether it's for endometriosis or whether the patient is any other pathology or gynae pathology. It's very useful in ovarian cysts sometimes to target the exact disease, especially when the tumor is very small, to visualize. And it's useful for all patients, and there isn't any special candidate for it.